Okay, today what we're going to be demonstrating is the abdominal brace exercise, and basically what that is going to be an exercise which incorporates tightening of all the muscles around the spine to protect the spine, create a nice environment for stabilization, which is going to be an important activity that we need to do for any type of exercise that incorporates core stability. And basically what I'm going to have you do first is I'm going to have you try to find your belly button right now with both hands. I'm going to have you go off to the side about 3 or 4 inches, okay? Just kind of dig your fingers in there a little bit. Now what I'm going to have you do is you're going to try to tighten your stomach. Imagine someone's going to come in and try to punch you in the stomach. Now you're not going to try to suck the gut in, right? You're going to try to tighten the stomach to try to brace the blow, and that's what the abdominal brace is. What I'm going to have you do right now is try to tighten the stomach, just like I'm going to try to hit you. Hold that for about 5 seconds. And while you're doing this, you're probably going to feel the stomach muscles kind of press into the fingers a little bit. That's how you know that you've done the abdominal brace correct. While you're doing this, I want you to breathe out. I don't want you to hold your breath while you're doing this, because that'll tend to increase blood pressure and might make you a little bit dizzy or woozy when you do decide to get up. Okay, and relax. All right, let's try it again. Tighten the stomach. And while you're doing this, you're going to feel the fingers, the muscles, press into the fingers. That's how you know you're bracing the stomach correctly. So we're going to try this about 10 times in a row for 5 seconds each, and then you just rest after that. Okay. And then this activity is the basis for any stabilization exercises that we're going to do that incorporates the lumbar spine. So this is the basis for any activity if we try to do some iliopsoas training, some bridges, or any other stabilization exercises. This is the basis for all that. So it's important that you get this from day one. Okay, that's good.
Following almost any type of back injury, we want to try to stabilize the front side of the body through a series of 3 different exercises geared at 3 different types of the body parts. The first part is the upper abdominals, the second part is the lower abdominals, and the third part is the iliopsoas muscle as a whole. The upper part of the abdominals can simply be trained by performing a simple crunch, maintaining cervical posture, coming up partway as a crunch, and coming back down. This is almost always fine for people with lower lumbar injuries from L4 through S1 areas. This may be irritating to people who have lower thoracic and upper lumbar injuries, and this should not be performed if it causes lower back pain. One should feel a type of stretch and exercise pulling on the upper abdominals. This exercise can be performed safely at home on a good solid surface, such as a floor with a blanket or 2, supporting the head and keeping the legs bent at any kind of type of angle. Coming up about 45 degrees would be maximal for this exercise. The second area that we want to target will be the lower abdominals. To perform sideline crunches, the patient will pull both of their legs up towards their chest using their muscles at the same time and just relax. Again, pull them both up towards your chest using only your muscles. This will strengthen all the muscles of the front of the trunk while passively stretching out the muscles of the lower back and the glutes. This will target the lower abdominal muscles, as the patient should brace in the entire abdominal and pull these knees both up to the chest. This particular exercise can be the first one performed following lumbar surgery once your physical therapist and medical doctor say it can be started. The third exercise is for the iliopsoas muscle, which runs from the front of the spine and the inside of the pelvis to the inside of the thigh. By starting the knee perpendicular to the table and pushing up into a therapist's hands or one own hand, where the hand is pushing down and the knee is pushing up, there is an isometric compressive force that will help strengthen this muscle. This exercise should be performed at home in groups of 3 to 5, alternating the hand, where this leg now pushes up towards the opposite shoulder for another few repetitions, and then use the same hand on the opposite knee, now pushing up towards the same sided shoulder, for a few repetitions, and then switching over to the opposite leg. This exercise is started when the hip is at 90 degrees. In time, your physical therapist can help you train where you're starting from a degree less than 90 degrees of the hip, and while pulling up towards your chest against resistance, we'll now work that muscle in a range from approximately 70 degrees to about 110, increasing the range that this muscle now functionally operates.